everyone doing? That was amazing, by the way. I feel like, yeah. Yeah, I feel like I really have nothing more to add. That was so amazing, and it just touched my heart in so many ways. I don't know where to start. So my name is Miho Kim, and I'm with the organization called the DataCenter. And unfortunately, I wasn't able to join the Institute yesterday, but I had the privilege of attending a little bit 2 years ago, and I was really just so inspired, as well as just taking a lot away, not only in my heart, but in my head. And so I actually want to start with asking, or taking a moment for each of us to reflect on our own about what was it, if you were, assuming you were all here yesterday, or even in the last hour that you've been here, what is it that made you feel so plugged in and engaged? Did you feel plugged in and engaged? Yeah, okay. I certainly did, and I'm inspired already. So let's think about that. And also, if you were here yesterday, did you have a chance to learn and teach and share and listen? Yeah? And did you feel like you were present and that you were value added in the room with people you didn't know, with people from all different walks of life? Which it seems like this room is a lot more than I think last round of the Institute as well. And thanks so much for all the hard work and the outreach and for everyone to be here. Does anybody want to just share really quickly what is it that makes you feel engaged and plugged in and present or value added? Any one-word responses? There's plenty of coffee across the hall, so okay. So it was partnerships, right? And just seeing how people work together, seeing all of the principles and values in action, perhaps, and just when something is forced, right? And when it's connived, even if it's seamlessly performed, we can see through that. One more? Yep. Sorry. So there's something really concrete or something that directly relates to your interests that you can apply, right, when you go back. No, thank you for sharing that. And, that's just a quick way to just reorient ourselves, and, myself included, that we're all here because we do know something about this topic. We're here to learn, and we're already learning a tremendous amount. But I think, today's topic is focused on design, right? And the design phase is where you really conceptualize and create the nitty-gritty, right, for the rest of the project. And so, all the strength and the knowledge that you have, this is the stage that you should surface all of that on the table. I am not personally in the academy, nor is DataCenter, and I will introduce the organization and myself through the story that will follow. But what I understand about CBPR is that it's fundamentally a human endeavor, and it's about human relationships. And for those of us committed to social justice, it's really about solidarity. And that means it takes two to tango, right? And there is so much insight as to how we can do that in different contexts, in different situations, with respective or sometimes complementary agendas, but that are different, right? And in shaping what that tango could look like, I think the assumption must be that each party knows something important about how to make it work. Because it has to work for each of you and each of us. And when I say you or us, I don't mean just you, the person, as an individual, but I'm sure many of you are here and you are representing either your organization, the people you work with, your families, your future generations you have in mind, right? So we have a lot of web of relationships right here in this room. And through that representation, you tap into a lot of knowledge and wisdom and interests. And that's something that I wanted to ground ourselves in. And do I have a half hour? Or I can try to rush it. But here's what I really hope to cover, is introducing the data center's work and approach to our partnerships. And touch on, this is what I hope you will take away, is why is partnership so essential? And how could it intersect, and should it intersect with the social justice movement and all of our shared interests for equity and justice? And also, why now? Right? There's a huge window of opportunity that I think is unprecedented, certainly is in the history of my own family and community. And I think that's the case for many of us. And that opportunity has been a product of the hard work put in by folks in and outside of the academy. And I think the context will organically lend to how design is critically important for those of us interested in engaging in partnership. And then I'll touch on specific lessons on design that we've gleaned from the projects that we've had the privilege to take on. But I want to be also honest and socially locate myself. My positionality is, I do represent DataCenter and I speak on behalf of the organization today. But at the same time, the CBPR, the topic of CBPR and what it stands for and what I understand it to be the mission of CBPR is so close to my heart as a third world woman of color from stateless minority community inside Japan. We're very much invisible. We're called Zainichi Koreans. I don't know if any of you have heard that term. I see some nodding heads. And, you know, today DataCenter's mission is really to integrate research, to put the power and the tool of research into the hands of communities that are organizing to affect community, institutions, and policy, and ultimately transform the balance of power and harmonize, and heal and harmonize all of our relationships, right? And that's sustainability of humanity. And that is something that I personally feel like I have a stake in. So, you know, I think in my talk, if you ever get confused, am I talking from DataCenter perspective or Miho Kim perspective? Feel free to call me out on it. I'm going to try to be disciplined about it. So, I want to just start with introducing the organization. So, DataCenter is based in Oakland, and it actually was founded in the 1970s. As a leftist free library / clipping service. Later on, one of the unclassified documents from the CIA quoted the data center, referred to the data center as the intelligence hub of the US left. When we saw it, we were like, yay! But what it is this is before the advent of internet, you know, revolution. So, you know, if the information was printed and it was there that exposed harmful US foreign policy practices abroad, it didn't do any good, right? So access was everything. The people that founded this library, as you see in the photo in our office, does not look like that, will tell you that indexing itself was political. And that was kind of the origins of the organization. But in the late 90s, you know, with internet revolution, the information environment and architecture in the world dramatically changing, the mission to fulfill the ability for communities to harness information as political power for change led the organization to focus on providing customized research services. And it was really focused on exposing the enemy for campaigns, exposing the truth, debunking the myth, right? Corporate propaganda, what have you. And that is one prong of what we provide to fulfill our mission. And the other is in the mid-2000s or early 2000s, we found that a lot of community organizations would approach us and say, you know, we really have this huge issue in our community and we need to actually reframe the debate, right? We need to really put out the reality of what farm workers are going through, right? Domestic workers, restaurant workers are really going through because we're criminalized because we're poor people of color, right? And we would go out there and try to find the data to find that there is no documentation. There's so many growing diversity of people in this country who are simply invisible in data. And that's when we said, in order to fulfill our mission and to serve the communities of color and the poor and the Native communities here in this country who are foremost impacted by research, right, history of research oppression, that we have to support them in documenting what their truth is, what their reality is, and to make themselves visible in data sets that really count for policy. And these are the logos of some of our partners, and I'm very excited that in the next several days, many of the representatives from some of these community organizations will be here to share stories of their partnerships. So, DataCenter is a movement-building research justice organization. We provide research support, technical assistance. We also provide capacity building, and we engage in strategic partnerships through research with communities. And those community partnerships often involve other academic partners, maybe filmmakers, GIS mappers, it really depends. But the key thing that we steward is community leadership in driving their own inquiry. And this is the problem statement in a nutshell. So you see the diagram, and you know, Nina just talked about different kinds of knowledge, right, and hybrid knowledge, and I love that. And so, you know, thank you so much for sharing that language. You know, how we understood the different types of knowledge that we encountered was, you know, we classified it into 3 different types: experiential knowledge, right? And then cultural and spiritual knowledge, the community knowledge, a lot of stuff that might never be open to external inquiry, but is definitely there. And then there's institutionalized knowledge, right? Kind of has that seal of approval saying this is valid knowledge, right? In the knowledge institutions in the country. Now what's interesting is there's a little arrow that says more political power up there, and that's something that we, you know, perpetually observe. At the same time, though, it's important that for communities that we remember the bottom part, that knowledge, it actually is a source of power. Maybe it's not political power in society, but cultural, spiritual power, right? Sense of identity, where you come from. And, but there is inequity here. And what are the different ways in which that inequity manifests? We call that research oppression. We were coming up with all these words because we're practitioners, and you know, we're not reading a lot of this like literature and stuff, right? So we're like, you know, trying to just make sense of it on our own. This is like in the early 2000s. So one thing we observed is that with grassroots communities that we partnered with around research, these communities had little or no control over determining what is valid knowledge or what is valid methodology, in par with other institutional sectors. And the second is that there was little to no access to the kind of information that did exist outside of the community that would impact the community or was about the community. So there was a huge right to know movement, right, and environmental justice as well. You know, right to know was a huge, you know, victory. And this is still the prevailing reality for a lot of communities. And it could be because, you know, information is expensive, there's increasing commodification, and it's like, you know, this hyperabundance of information in Google, whatever different reasons, right? And the third is, we also see this a lot, is either misrepresentation or underrepresentation or non-representation in the data sets that actually shape policies that then impact you. We work a lot with, you know, formerly incarcerated peoples, you know, urban youth of color, And there's so many people, queer people, that are criminalized, and the data sets that are actually created justify that kind of ideological or kind of prejudice, right? That then allow for the policies to continue with impunity. So we see that as a direct harm of research oppression on communities. And the last is communities are also denied political legitimacy of the knowledge that they do have, unless they are cooked in and by dominant institutions. And so this is the pyramid that shows that there is inequity or imbalance in political power specifically, right? On the other hand, so then what does research justice look like? Now that was talking about research and justice. And research justice is about reclaiming community knowledge creation and considering all knowledge types and all knowledge creation methods as equally valuable, right? They all have their place in the world. And the diagram, shows the different types of knowledge more harmonized, right? And it's the flip side of what you saw. That communities have access and the capacity and the resources and the know-how to access information outside. And they also have the power to define the type of, to determine what is legitimate knowledge and not. And that community also has the capacity to produce and to apply, preserve, own, possess, right, their own knowledge. And also are considered legitimate researchers. And this is a huge challenge when we do support community organizations doing original research. Oftentimes that in itself is not taken seriously. So if you're aiming for public coverage in the New York Times, then strategically you're going to want to think about how do you actually up that political legitimacy, right? So much of research that we do with a team of social scientists and other professionally trained researchers, organizers, and campaigners is actually fundamentally political. And so to go from the left to the right, what is it that we need to be doing? What is a place for DataCenter in the world that's not affiliated with the Academy and that kind of has this unique vantage point supporting diverse community organizations? Some of them are really small, scrappy grassroots projects, really just in the front lines, and other ones have been able to institutionalize, right, some of their interests. The whole 9 yards is transformation through community-driven research.
I'm sorry, I was just wondering if you could, the words that are in those gray circles, maybe my age, but I can't read them.
Thank you for calling that. Yeah, I'm happy to read it. So when we created this diagram, we used this language, mainstream knowledge, to refer to knowledge that is institutionalized, right? And the bottom is this experiential, cultural, and spiritual knowledge. We also, use traditional knowledge, community knowledge, and under our vision, cultural and spiritual knowledge, the knowledge that's in the communities, a lot of times in the hearts and minds of the people, maybe in historic memories, right, is one circle. Mainstream knowledge, we also call institutionalized or scientific knowledge in the bottom, and experiential knowledge.
Thank you.
You're welcome. Hi, Danny. So, I keep forgetting there's a videotape going on. Sorry, I keep moving around. So, I'd like to take a moment to share my personal story and kind of weave that into the whole story of why we believe that partnership is so important, and to break down barriers and boundaries, and how that really relates to what I believe is all of our shared agenda. And in doing that, there's a big hype about storytelling and story sharing, with StoryCorps and different things out in the world, and it's really wonderful, but that actually made me think about where I share my stories and where I don't. And to share personal stories sometimes, it it feels like out of your comfort zone. I don't know. Do you know what I'm talking about? Like, you know, it's just like, it's fine to listen to other people's stories, but so, you know, I just want to, and I like to, when I introduce myself, I like to share that it took a journey for me to be able to weave my story, my personal story, because I was so conditioned to hiding my identity. And it's a product of assimilation policy that Japan has used against other countries. In my grandparents' generation, I didn't live during the war, but somehow I've internalized it. And it's fascinating. I don't know where it came from, right? So where do I start? I also have something to say, and I know something, as all of you. But I confess that I was so obsessed with the belief that I knew nothing, or that I didn't know enough, or that I don't know the right stuff that I was supposed to know, how I was supposed to know it, right? That I never actually took the time to ask myself, what do I know that I can bring to the table, right? And Nina talked about the strength-based, approach. So you have to come from a place of strength. And for, I think, many communities that we've partnered with, that in itself was a project of unpacking and creating safe space where you can actually come into touch with that and reconcile that, right? And that really is a prerequisite for trust building with external entities as well. And we had, DataCenter held the 35th anniversary event where Dr. Michelle Fine, who's the founder of Public Science Project and does a lot of amazing academy-community partnerships at CUNY, came and gave a talk. And in response to her question about how did she get into this, work, she's very passionate, just goes above and beyond and really just forges solidarity through research with communities. She said, she shared the story of her mom. And she said, my mother was very, middle class, white Jewish woman, very quiet, model homemaker, right, of that generation, and very quietly raised her kids and didn't have a lot to say. And in her old age, she was in bed, and Michelle said, Mom, do you have anything you want to say? They were having a conversation. And her mother, for the first time, took a big sigh and said, I have so much to say. And Michelle said, I was never connected to what was there. That disconnect itself is so normalized, the way we live. But really, if you think about it, how did that happen, right? There's clearly barriers and boundaries. Just like the ones that exist between academy and community, right? Straight gay people, white people of color, the rich and poor, right? And so on. And I realized looking back that I also recreated that boundary between me and myself, and my past, and my experience, and I was entirely disconnected from who I really was. And so in terms of decolonizing methodologies, we have actually, as communities and people from all walks of life, a lot of work that we can be doing that actually is conducive to readiness for partnership that might not be captured in the framework for a research project. And at the data center, because we partner with communities and try to facilitate a process of capacity building for community groups to then forge partnerships with other entities and scale their organizing work, this is something that comes up perpetually. And it's very, very important that we take the time to address this together. And transforming boundaries is not just work that happens outside, right? Now, it is also established that when people recount experiences that have to do, involve trauma or pain or fear, right? And that story is rejected or belittled or not received, then, there's abundance, I think, of evidence, right? Scientific evidence for this too, that I recently learned about, that trauma is triggered all over again. So there's another layer of trauma that is experienced by that person. And so a lot of communities, talk about this through their own experiences. I think before I learned about the study, and many of us learned about the study, we have been observing it. And So there is a mechanism for internalizing, perpetuating those boundaries by withdrawing. And also, it's important to note that I think it's actually harmful if communities deploy our stories and then it lands flat on the ground for it to be, just kind of there, and not taken notice. And we have heard so many people in the environmental justice movement, the fence line community say, we have been saying time and again, this asthma's gotta stop, right? Or women, who have, are survivors of sexual violence. Say, how many times do I have to recount the story? And how many times do I have to recount it for the policy to finally change? Now, the DataCenter has taught me on a deep personal level that my story still does count. So research justice is a theory of change that seeks to break down barriers and transform boundaries in order for communities to be recognized experts on par with other institutions in society and gain equity and justice. So there's two things that are important in research justice from this context is that A, I think communities have a prerogative and a responsibility to be mindful about telling our own stories and information. If we don't, we say, if we don't tell our own stories, somebody else will tell it for us, right? And up front, being mindful of the impact of deploying the story out there, because the reaction or the non-reaction to that story can also hurt. And having an academic partner, if we are strategically determining the terms of the partnership, can absolutely shield our stories from potentially damaging consequences. And Margaret Gordon, I was a keynote yesterday, she once told me, people knew there was crap in the air, but unless we had scientific evidence, we were not going to be heard no matter what we did. And so she engaged, science, but not only did she get scientific evidence in the process, she actually took advantage of the process to involve community people, the young people, and the young people had developed transferable skills, and there was curiosity, right, and wanting to learn more. And instigating agency is the most subversive act you can engage in the community. So you instigate agency, and you provide political ammunition of data that can actually become powerful tools in the hands of communities. So, many organizations approach DataCenter for research support after they've hit the kind of wall of facing opposition in their change efforts. In essence, this tells us if science indeed is objective, then the way that we use science to create data and knowledge and how it's funded and how it's applied is certainly not objective, and it's political. And we believe research is political and non-research is political. There is choice being actively exercised about what is made visible and not visible. And so we believe research is fundamentally about power. And the community's histories attest to it, as we saw in the earlier slide with the scientific experiments on marginalized communities. It's for what end? And so this is the backdrop to DataCenter partnering with domestic worker women in New York. And first in New York and then in California. I want to pull up that slide. Okay, I'm being a little challenged here. Let me just skim through the story. Yeah. No, it's okay. So let me just skim through the story. The domestic worker story is something that we wanted to share. Are you familiar with the domestic workers organizing for the domestic worker labor rights legislation? And some of you are nodding heads. So domestic work was not protected in labor law in this country. However, in 2010, Governor passed into law the Domestic Worker Bill of Rights. And this campaign was a 7-year-long campaign led by domestic workers, many of whom are very vulnerable in the informal, invisible industry. And in 2003, DataCenter and domestic workers in New York partnered to create the first ever documentation of the working conditions and the demographics of this particular population. Now, this process was an involvement between the academic partners as well as the members and allied organizations. And the domestic worker women themselves were effectively able to leverage the political legitimacy that comes with social science methodology to elevate their authentic voices in advocacy efforts to forge alliances across sectors and industries. And I don't think it would have been possible without partnership with allies within the widely recognized knowledge institutions and a process whereby leadership development was an operating principles. So we designed the documentation to allow for a lot of stories, noting that stories don't discriminate. Everybody has a story, and everybody has is familiar with storytelling or listening. And we incorporated a lot of story share into the design and the strategy development through the analysis process and behind. And Nina talked about bringing the data back into the community and contextualizing it. And so there was this whole seamless kind of, traversing of different sectors in that microcosm of the partnership space. And that was intentionally created and structured upfront in the design phase because, the question was, how do we actually make alive the operating principle throughout the life of the project? And you have to budget accordingly, you have to put in the time, accordingly, and so on and so forth. And this example of domestic workers is about one possible way to harness the power of stories on the ground and take them all the way to the governor's office unscathed, right? And they were honored and won the hearts and minds of the people, and also they had the arsenal of scientific evidence at their side. And became a force for political change inside a dominant institution, historically dismissive of stories coming from marginalized communities. Now, why now? And Nina mentioned this also. There's increased amount of invitation for community participation and research projects in the country. And the success of various institutions actually also depend on the ability to integrate meaningful input from communities. And so there is shared interest, and the communities also have, to gain from having to participate in shaping policies, right? And public health sector in particular across the board is an arena where we're hearing a lot of this particular trend. And we actually feel that this is a growing clarion call, far and wide, to move community knowledge and voices from the margin to the center in all arenas of society, beyond the comfort zone of our communities. And Ami Fishman is somebody who participated in shaping the Institute 2 years ago. And I said to Ami, so what is CBPR? We've been hearing about PAR, participatory research, and we're practitioners. So how do we really understand these different, concepts? She said, CBPR is like the liberation zone inside the academy. and it just, that was so clear to me. And the institutional space, liberation zone, creating that in institutions is really hard to carve out. And this subverts the power of the ivory tower from within, and it's not easy to do. And so, I just, have incredible amount of admiration for those of you, who paved the way for this. And the opening is created, and when I hear that communities are more and more demanding, more of this kind of opportunity, that speaks to capacity that was probably not there to that same extent before in a prior generation. And that is an amazing opportunity, right? And so let's support and cultivate relationships with more grassroots communities that might not yet have the full capacity organizationally to engage, but on the trajectory of actually engaging in these powerful research relationships. And so, as demonstrated in the case of domestic workers organizing, the marginalized communities can build their own power in the most holistic sense, with stories and a sense of what is the value added and the specific types of diversity of expertise that every party brings to the table. How do you really create a space that is politically empowering, but also culturally and spiritually nourishing? Because so much of this process is conducive to healing as peoples and communities and organizations. And it helps break down the barrier and boundaries that we have inherited between institutions and sectors. And that's why we say research is a means of solidarity. We believe that it's a subversive act to challenge existing boundaries that do not serve us, and to transcend or transform them, and to recreate boundaries that serve us. And so I saw in the listening project training curriculum table of contents, the visioning, right, was up front. And that is a really wonderful place to start, not even bringing up the word of research when partners come to the table. What is the shared vision? And there's so much in common there. And I just want to wrap up quickly with project design, the lessons that we have learned, and surely that will be enriched by what other folks will have to share. And I put this here because I heard somebody say you have to come into partnership and stand cleanly, right? And in the muddy waters is something that I added. I'm from Japan, southern Japan, and there's a lot of wild lotus. And lotus is beautiful, but if you've ever fallen into a pond with lotus flowers, you'll know that water is nasty as hell. And there's mosquitoes, larvae, it's really muddy. But that's the beauty of it, is that so much beauty can just stand, right, in this like hot mess. So we are kind of in a hot mess in a sense that we have all these barriers and boundaries, a lot of which we've internalized and normalized. And so let's start by visioning and then taking a step back to inventory what are those boundaries and barriers that might actually contribute to dynamics. Because that actually provides insight on how to effectively navigate the dynamics and cultivate our kind of the solidarity muscle, if you will, right? And so these slides, I believe, are going to be uploaded later, so I won't really go into reading them out loud. I try to make it so that it's kind of self-explanatory, but the first slide has to do with really the readiness assessment, and it's not so much to say, oh, you qualify, you don't, but it's really a self-reflection set of questions that we often use in determining partnerships and the level of the depth in partnerships that we might engage with communities. And the next is, what does the research serve in terms of interest and agenda? So we carry out this kind of an exercise of political impact assessment, right? So is this research information, how is that going to benefit communities, right? That's like one of the tenets of CBPR. So is this particular research intended to shift the balance of power, right? If so, is it temporarily or structurally, right? What is their expectation about outcomes? And what is accordingly the deliverable that you might create, the kind of language you might present that in, right? Who might present it, and what kind of trainings go into making all that happen. So it's really good kind of exercise to impart a lot of nuanced understanding of how that design could occur. And the third is the nitty-gritty, enough said. And then just something about learning and evaluation. This whole praxis, right, of research, action, reflection, is very hard to do. In community, organizations, it's just like, surviving, and you're just kind of trucking along. But really building the methodology of capturing the lessons in all phases of the project intentionally, but also being mindful, what are we trying to measure here? What knowledge is going to serve us? And that has been critical for us as an organization really trying to strengthen the muscle of solidarity to scale the work of the communities, to learn better what are the key elements, right, of how to practice that, how to actually show up. And understanding it intellectually is one thing, right? And so there's a lot of training that your whole body and the cellular training also becomes really important. And these are some of the guiding questions for further discussion that I think we at the Data Center have found is really pertinent. And again, these will be up, so I'm going to close up in the interest of time. Any questions? I think we actually wanted to leave some time for questions or comments. Can we take one or two? Yeah. Oh, so maybe more than that.
Any comments or questions?
I'm just sitting here reflecting on your comments about the outcome being, an increase in power, kind of as the positive outcome. And that resonates with me very much because I always see that kind of as maybe like a process outcome, and oftentimes, we look at health outcomes or, the larger community impact as outcomes. And I just think it's interesting how you're actually looking and measuring power as an outcome. I just found that to be.
Thank you.
Well, just to add to that, I often try and create this other column in between process and health that I've probably talked about this before, that I call system or capacity outcomes. And sort of an intermediate system and capacity outcomes power is a system change. Can be thought of as a system change depending on how you're thinking of which kind of power and where, but if the community has more power to demand things, that should be thought of as a system change, and you would hypothesize that that power then gives them the possibility of actually improving health. So, but I think of those as real outcomes, I just call them system and capacity outcomes rather than processes, because in academic terms, if it's called an outcome, it's given more weight than if it's called a process. Yeah. So I just like to call those a system outcome, it's a power change. That's just how I think about it.
Yeah. Great. Thank you, both of you, for really wonderful presentations and very inspiring presentations. Particular question with the Data Center, since you have this long history of collaboration and strong work with different communities, have you had the opportunity to reflect on kind of the national or even global, like holistic impact of data centers engagement and of the communities themselves that you collaborate with?
Impact of data centers engagement?
Data centers engagement, and obviously through like those partnerships and through the real strong work that the community.
Is that something that we can propose to NIH for funding? No, I'm just kidding. No, I mean, it's because that's a lot of work. But having said that, thank you for asking, because we are talking about reflection and how are we doing our own reflection too. What we've been able to do is draw on a lot of testimonies, because a lot of our work has been through relationships and crossing a path in the social justice movement. And so we a lot of times partner with these scrappy grassroots, organizing. 10 years later, the women themselves are leading a national formation of an unprecedented alliance. Not only are they passing laws in New York and California, Colorado, and Illinois, they've gone to the International Labor Organization and gotten a resolution, right? Declaring that domestic work is real work. That's, one story right there. So we do reflect on other examples of where we've had to the opportunity to truck along the whole 9 yards, because with shorter projects, it's really hard for us to learn. Annie and Casey found it, well, maybe I should name them, maybe erase that from the video. But I visited this foundation who does a lot of research and data and evidence-based. And so they have a leadership fellowship. And they really talk about the impact of their leadership and capacity building and stuff like that. So I asked the person who's responsible, how do you really measure the impact of your leadership the fellowship program? And she said, oh, you know, the leaders themselves, you know, talk about how impactful it was. And I was like, oh, we can do that, you know. So I mean, there's that too. But I think it's important not to trivialize, you know. And yeah, but it'd be great to be able to have like a larger study.
No, but I also think, actually on Thursday, Meredith Minkler will be talking about how you look at policy change, and Miho's example of moving from, you know, different policy changes in 4 different states and then to an International Labor Organization resolution, those are policy changes. And so those are real. And there's, so I think as CBPR moves into policy more directly, you know, the examples that Miho gave can also be, we can look in our own projects for that as well. And, you know, and I think those are real and could be documented, and, you know, takes time, and that's the challenge.
I have a question. I wonder if you have any suggestions or specific tools or ways for community-based organizations to build their capacity to be able to participate in the kind of research that you're describing in the ways that you're describing. You know, oftentimes in community organizations, we are approached by researchers who would like to have access to the communities that we work with. And sometimes we're at a great disadvantage because, you know, we would like to participate, but there's just so many disadvantages that we might have, or lack of capacity. And so and especially so, let's say over the long term, if you have some ideas about how we can systematically build our capacity to be able to really be in a meaningful partnership with researchers.
Thank you for asking that really important question. It's something that we also ask ourselves. Recently, I organized a panel around community-driven research with Kevin Riley, who's with UCLA's Labor Occupational Health and Safety. And there's a sister organization at UC Berkeley that you're with. And these 2 offices do a lot of community partnerships around research, but are not sole partners, just like in the way that DataCenter partners with community. So picture like a tripartite relationship. So, you know, a lot of times people talk about community-university partnerships. And that's just too on level of a playing field because of the proficiency differences maybe. In which case, in the panel, a lot of the community groups that have used sort of the third party, you know, support have spoken about how that has helped them engage more proactively. So it's kind of like augmenting their capacity and you know, to be proactive participants. So I'm sure there are many other offices or, you know, other strategies, but that's one that I could think of.
I actually think that's a great need, Marcos. I don't think it exists. This idea that the community, there's almost like a checklist for how are you going to show that the university is accountable for the community-based organization, or how are you going to show that the community-based organization should partner with that university or that group or groups. You know, and I don't, you know, this kind of idea of a accountability checklist or something, even as a start, has been talked about a lot. You have a comment on that?
I also think we need capacity building at research institutions and universities around how to conduct CBPR. I think there's a great deal of ignorance and just a lack of understanding of what it means to do community-based research. And if you have ideas about how to build that capacity, I'd like to hear those too.
They're active, yeah. I mean, we're trying at New Mexico, we have an annual CBPR institute that we've been able to do on a much smaller scale than this, but as a summer institute. And I think the more institutions that have that and the more that's, I actually think the partnerships, to be honest, in terms of working in the big elite institutions with this clinical translational science award and institutes are key to transforming our own institutions, because that's where the big bucks are. And, you know, I don't know, Seth, if you want to comment on that, but I really believe we have to work, I mean, we have to really challenge internally our own mega elite places.
You know, I sit in one of those.
I know.
And it is an incredible challenge.
I know.
To get any sort of support for community-based research. I mean, there's just a huge bias against it.
Well, I'll give you a minor, it's a major example, but it's so tiny example. In my institution, which claims to be a public university, University of New Mexico public, serving the community, a long history of students out, communities out, and connected, and we have a Vision 2020 where we're going to reduce disparities by more than any other state by 2020 in our, so we have this medical school vision. Our community-based engaged research pilot projects refuse to pay for travel, food, and students. How can you have a CBPR pilot that will not pay to let you get outside of Albuquerque? We have a very large rural state. So this is like the most bizarre policy. And talk about disincentives to new faculty wanting to do community-engaged research who don't have added dollars that they can bring from elsewhere. You have to bring food to community meetings. So it's sort of like, what is this policy?
I think it's based on the view that it's just a party, right? And then, you know.
So yes, we have a long way to go. Yes, second.
Yeah, well, that's a good question, Leo, about how to go about doing that. And I agree with Nina that the CPSAs, that for those who are not familiar with that, stands for Clinical Translational Science Awards, which is a $500 million a year investment, public investment through the National Institutes of Health. And in that initiative, community engagement has been a core part of the process. But it has been quite a bit of work. And one of the reasons is that that particular initiative is primarily driven by basic researchers who have no idea about working with communities, and many of them have never worked with humans. It is very challenging. But you know, Nina mentioned what they are trying to do, and you have, Nina, an infrastructure that way before the CPSA you have been working with communities. And the example that you just gave, you know, that is so backwards, you know, to restrict funds for gatherings or meetings with communities, not having food and not having money for transportation or for honorarium, you know, for community partners in ways that facilitates. That it happens in many CPSAs as well. It's a challenge. In our institution, what I would like to share is that we at UC Davis, this is a School of Medicine, we have developed and have in place for 5 years now this course that we call Get Real. And it is for junior faculty and fellows. These are the fellows in training to do research, and it doesn't matter if they are not doing research with communities. Actually, it's even better. And some of them are working with you know, veterinary medicine and agriculture. And the purpose is that, you know, to get them real. It is to have their feet wet in community work, but one discouraging point is that you would think that these efforts are incremental and accumulated. What we have found is that it doesn't happen sometimes, you know, because if there are new leadership that are at the helm of the whole initiative that you know, doesn't get it, then the gains don't seem to. There is reversal sometimes. So it's very challenging, but you know, Nina just mentioned the IOM report that was released today. This is a tremendous boost for community work. And Nina just mentioned that community matters is the message of that report. Very empowered by that report. I think that we ought to really read it and do work related to that.
So the strategy from the top is to, if an Institute of Medicine report supports community engagement, that's the current more neutral term than community-based participatory research or community-driven research. But still within community-engaged research, we should use the Institute of Medicine as a hammer in our own institutions. And at the same time, ally with these incredible strong partners like the DataCenter, like the partners that are in this room, and benefit. I mean, I've had to ask my tribal partners, you know, when we have these long consent forms and, you know, and they only wanted, you know, that were based on all this patient data, we're not doing this, and we have this more community intervention. I said, will you please, I go to the governors of the tribes, I say, will you write a letter to my institutional review board and say, you refuse to do research with me unless you have a one-page consent form. I got letters from the governors, and the IRB changed, because, so, it was so you benefit with community partners, hopefully, and that, you know, we need community partners to do this work. We can't do it alone for me to transform the institution. So it's a big challenge.
Yeah, I just want to piggyback on your use of terms and like IRB, and you're right, a lot of the stuff isn't on humans, and so some of the researchers they'll say, well, this has no clinical significance, so why should I give the results to these people? They won't understand them, they'll just get worried. And we've said, they're human beings who participated in your research, and so they deserve to, you know, ethically know that this was part of their life history, like the syphilis experiments, you know, are such a bad example. But anyway, quickly, I'll just say one way that we were subversive around that is we asked I was a medical director of a community health center that had 40,000 migrant farm workers in the area, and always universities were wanting to do research on different things in that population. And we said you can only come to our center if you will let us see the results before you publish them, because we'd had some bad experiences. Oh, well, we got promises that they didn't keep. They said yes, and then that didn't happen. So the next step was we just used their language. We were like, you have to pass our IRB. And they were like, what? We've passed our IRB. It's like, we don't care. We have our own IRB. So actually, that is how we started, and then it became a national IRB with the organization I work with now, and that's what we've done. We're like, you can have all the IRBs you want, but before you're working with this population, you have to get through our IRB. So that's another way to do it.
So that you as a community partner are helping demand changes from the university folks, so thank you. So one more comment, and then let's have a break.
I was professor of School of Medicine in the country where I come from, Guatemala. And about the question of why that we have to teach the students how to work with community. It's practically nonsense for the kind of medicine that we have here. I have a doctor who works with my heart, another works with my prostate, the other works with my liver, and no other works with me. That's the reality of the medicine. We don't have family doctors enough to cover the whole population, even if we pass the law for universal health care, etc., etc., etc. So we confront the reality and we dream about this kind of program. Let's be awakened.
Good note. Great place.
Be awakening. Well, thanks all of you for wonderful comments.
So the program now is to take a short break and then come back for a dialogue around partnering. So we can do that, or the other option is to start the dialogue around partnering and have a longer lunch, leaving at 11:45.